at Germany, Thailand, and Hong Kong. Founder Chairman of Netra Jyoti College of Allied Health Sciences and Paramedical Sciences, and Vice President of KOS and Member Scientific Committee of AIOS. He has been awarded with many national and international awards, amongst which the most prestigious are Karnataka Rajotsava Award in 2019 and Nadoja title was given by Hampi University in 2021. Dr. Kundlu will be operating smile in the right eye of the patient, who is a 38 years old lady with uncorrected visual acuity of 360 in both eyes and best corrected visual acuity of 6.6, and acceptance is minus 3.25 spherical in the right eye and minus 1 cylindrical at 30 degrees, and in the left eye minus 3.75 and 0.75 cylinders at 170 degrees, improving to 6.6. Pentacam maps, or there are no outliers or red flags in pentacam maps. They are pristine maps, and bad maps are also pristine with no red flags in it, as we can see here. And there are no significant internal and corneal aberrations in both eyes, and DLI is good, and epithelial maps are pristine too. It's pleasure to have you, Dr. Kundlu. Over to Dr. Kundlu.
See the light, straight. Just put your head on like this. Can you hear me?
Yes, sir, you're audible.
Yeah, am I audible in the hall? Satanshu bhai?
Yes, you're audible, sir. Can you hear us?
Yeah, may I know who is speaking?
Dr. Rohan this side, sir.
Yeah, Rohan, first of all, thank you so much for a lovely lunch you had given me this afternoon. I am so touched by the hospitality. I thank Dr. Vinod Arora sir and mainly my brother Gaurav bhai for this wonderful opportunity. What a place, the place of hospitality. It's people call it as a Devnagari, that is Uttarakhand. So he has given me chance to operate in his OT. I am so much thankful to him. This is one of my dream mission. I have trained lot of doctors in and around world. More than 50 doctors trained by me, especially for smile, scissor system. So this patient name is Preeti Raikar, aged 37 years old. She wants to get rid of her glasses. So always in smile, very important is positioning. You need to have a very clear access to your ocular structure. So always once I clean the cornea with the fluid, make sure that there is no meibomian secretion is around, which is the culprit for most of the post-operative haze and also ectasia. So you have to clean it thoroughly. The principle here mainly keep the conjunctiva dry and keep the cornea semi-moist. This is very important. Put your chin down, sister. This is very important. Always your position has to be very good. So I am taking out all fluid out
Sir,
of
we
the...
don't have your eye on the display. Actually, we only have the machine display at the moment.
Yeah.
Yes.
First now I will show you the setting now. The patient name is Preeti Kakkar, age 37 years. This is the setting. Right eye minus 3.25 with 1 cylinder 30 degree, and cap data is diameter 7.5. The cap thickness I kept here 120 micron and side cut 90 degree. So the residual stromal thickness going to be remaining is 321. Okay, next. Now I'll go to the expert mode. Here energy is around 28 in this machine. Pretty good. Now what I will do is, as a surgeon myself, after checking all the parameters in the machine, now I will take the cone from the right hand, hold the cone in the right hand, go to the machine, plug in, then you lock it. Then for right eye, you hold it like this, go to the slot, lift a bit, you will hear something called click noise. When you heard the click noise, machine will start calibrating for this particular cone. So once again, I am flushing the cornea. So whenever machine is start calibrating for that particular cone, normally I don't move the table, because sometimes we never know that when it is calibrating, you should not touch the machine. Once it is calibration done, I think you can go ahead with the procedure. So as I said that, after the thorough flushing, keeping the conjunctiva dry, keeping the cornea semi-moist is the key for successful of smile surgery. Can you able to see, Rohan, eye
We can see the display, sir, not the eye.
now?
Now, yes.
Are you able to see the eye?
Yes.
Yeah. So, sister, this is squeezed, no? So, now I am making the cornea semi-moist. Once the cornea is semi-moist, I am taking the patient underneath the cone. So, you have to ask the patient, प्रीति आप थोड़ा ग्रीन ब्लिंकिंग लाइट देखता ही रहना. अभी ग्रीन ब्लिंकिंग लाइट आएगा आपका आंख के सामने, आप सीधा देखने का. सिर्फ 1 मिनट का प्रोसीजर है, हिलाने का नहीं. इधर देखते रहिए. So I am just going to dock the eye now. When you are docking, make sure that you are docking exactly in the center of the pupil. Very, very important. Once again, depend upon the patient. Dock it. Once it is 80% docking, now give the suction. Keep seeing like that. Keep seeing like that. Now I am pressing. After the good suction, machine will start with the lenticule cut first. Then with the side cut. Now it's doing the cap cut. Then followed by the incision. You can do the incision between 1 to 4 mm depending upon the surgeon's preference. So the perfect treatment is done by the machine. So you have to get the eye underneath the microscope. Once again, you can see how I kept the cornea semi-moist and conjunctiva dry. This is the 2 key points for success of smile, because 50% treatment will be done by the machine, 50% treatment has to be done by the surgeon. So learning curve is little bit there in smile, but once you are master, I think it's a very easy surgery. Sister, dissector. Dry but. So now the most important step is identification of the layer. So sister, keep seeing like this. No, straight, don't move.
So what instrument are you using? Is this a specialized one?
No, this is not a special, this is a simple one. It has got a long dissector and a short dissector. With a short dissector, Rohan, I am trying to now identifying the first layer called anterior layer. Go to left side, your periphery of the left side. Open the anterior plane properly.
Check.
Now once your anterior layer dissection is over, now you can see something called meniscus sign here. Meniscus sign, this is very, very important. So underneath this meniscus sign, you open the posterior layer bit, and don't open it till here. Only you open in your right side. Once it is done, now I am turning my dissector. Go to the anterior player once again. Do a dissection, something called a windshield wiper movement. So I am dissecting the anterior layer. Now our superficial layer, and my superficial dissection is over. Once my superficial dissection over, now I am going to the deeper layer. Now do the dissection of the deeper layer. But when you are doing the deeper layer or posterior layer, you have to dissect both the side equally. Otherwise, chances of lenticule may fold. The beginning surgeon may become little difficult. So both the side equally I am dissecting. Yes. Now left side dissection over. Now right side also dissection over. Now I will do something called single instrument technique, where I will not be using any of the dissector, and with the help of the same dissector only I am taking the lenticule out. If you want, I can put it over the cornea, spread across, see for a integrity of the lenticule which is round. So only one with the help of the only one instrument, I could be able to dissect this lenticule. 1 drop of saline, sister. So for smile dissection, you don't require 2 instruments. If you ask me, if the treatment done perfectly by the machine, then only 1 instrument can take out the lenticule. The advantage, lesser the dissection. You can see the round lenticule here. That means my dissection is perfect. So lesser the dissection. That is very, very important. That patient will have a wow effect very nested. 6 by 6, even 6 by 5. Once again, you will not be touching any of the Bowman's layer. You could able to see even going and giving the wash underneath the within the interface is also not required. But here I am just giving you the interface wash. Once your interface wash is over, the most important step is ironing of the cap. This is very, very important. See, ironing of the cap always prevent patient to some patients may develop, especially when you are operating for very high refractive error, the chances of developing microfolds will be there. But if you iron it properly like this, then there is no chance of having any microfold post-operative, and patient normally will have a 6 vision. So you could able to see how nicely I am ironing and the treatment done perfectly well. Once again, I thank Dr. Gaurav and the whole team given me opportunity. I wanted to reveal or may not be revealed. Actually, Gaurav bhai came to Udupi to just see my live surgery, almost some 5 years just before buying this machine. And he had invited me all the way from Udupi. I am so much thankful to him. Once again, I thank Dr. Vinod Arora sir, the whole team, Satanshu Mathur, the whole Rohan, his wife, everybody was got so much of love towards me to calling me all the way. So any doubts you can ask me.
Expertly done, sir. The only thing I wanted to ask you that while you were ironing with that instrument, sir, how do you take care that the epithelium does not get damaged? Like, of course, when you're doing it with a sponge, then it's all right. But when you're doing it with an instrument, how do you make sure that when you're ironing it, that the epithelium is in place?
Nothing, like just a share of experience only I had done. This is my technique with a single instrument. I take out the lenticule. So any questions?
Do you change the size also according to what the power is that is to be treated, sir?
No.
For the flap?
I will tell you about most of the Indian eyes, we take a smaller size cone. But if the white to white diameter is more than 12 mm, better to take a medium size cone so that you will have a very good treatment. Suppose if you want to do a hypermetropic, that is a femtoLASIK, then medium size cone is always better. Then once again, setting is very important depending upon the Pachy value. Suppose the patient you are treating for a very high power, -8, -9, or with some cylinder. That time normally I reduce the cap thickness from 122 up to 100 also. That is very, very important. Suppose if I am operating -1, -2, then I increase the lenticule thickness up to 30. So this is very, very important. The adjustment what you have to do within the machine. Then apart from that, I think if you keep the conjunctiva dry, cornea semi-moist, normally treatment will be ultimate.
And what is your range, sir, for spherical and cylinder for smile, minimum and maximum?
See, I have done cylinder up to 5 cylinder. I don't have any problem. And I have done some of the study actually. Initially for cyclotorsion, I have used to mark underneath the slit lamp with the 5 patients. But absolutely there is no difference as far as the marking or non-marking. Now I have stopped marking. The results are pretty good.
Thank you.
Very high power I have operated so far, -10 with 4 cylinder. Patient had a Pachy of around 620. Patient is doing extremely well.
Thank you so much, sir.
Thank you, Rohan. The other eye will be done by the genius surgeon, that is Dr. Arulmozi Varman.